everybody, my name is Carol Mack. This tutorial is meant to give you a broad perspective of HIPAA. We begin our series with a timeline and a brief introduction to our characters. The Pruitt Medical Group sits on the corner of the plaza in the center of Single Peak, California. Priscilla Pruitt began her career in 1970. Her husband Hudson joined the practice 10 years later. Hudson bought his first portable computer in 1986. Priscilla favored the typewriter. 10 years later, President Clinton signed HIPAA into law. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. Congress intended to improve health insurance through accountability rules and by simplifying the administration of health insurance. Simplification rules are given in Title II. This title also created the electronic data interchange to make HIPAA transactions more efficient. There were no privacy rules at the time. HIPAA privacy rules had to be created from scratch. Congress asked the Department of Health and Human Services, or HHS, to submit recommendations on standards with respect to the privacy of individually identifiable health information. When Congress failed to meet the 36-month deadline, they delegated authority for HHS to promulgate final regulations on privacy. When the proposed rule came out in 1999, HHS was flooded with public comments. The original final rule was ultimately published in December of 2000, but complaints kept coming. Some rules were too complicated to follow. HHS backpedaled and opened a second period of public comment. Another year and a half went by and HHS finally published the privacy rule with several modifications. The initial compliance deadline was 2003. The Pruitt Medical Group was prepared. They had their notice of privacy practices ready to distribute to patients. HHS also published the security rule in 2003, but this didn't become mandatory until 2005. Privacy and security regulations were codified in Part 164 in 3 subparts. In 2005, Hudson used the computer for correspondence but not billing. The biller sent insurance claims by mail and followed with phone calls. X-rays were recorded on film media, not electronic media. Prescriptions were sent to the pharmacy by fax. The security rule only covered electronic PHI. Paper, fax, and telephone calls were exempt. The Pruitt Medical Group was content using paper forms. They didn't want electronic records. HHS seldom prosecuted HIPAA privacy violations. CMS was responsible for the security rule. The Office of Civil Rights enforced the privacy rule. In 2008, HIPAA violations gained media attention when several UCLA employees were caught snooping. Several celebrities were involved, including Maria Shriver, the governor's wife. A few weeks later, Governor Schwarzenegger signed legislation to strengthen medical privacy laws, and Cal Ojai became the lead agency for HIPAA enforcement in California. A few weeks later, President Obama was elected. In February 2009, the new president signed the American Recovery and Reinvestment Act. The Stimulus Act appropriated $18 billion to support health information technology. Part of that money would be used to lure doctors into using electronic records. Hudson and Priscilla took the bait. In 2011, the Pruitt's lawyer helped them update their HIPAA policies and procedures. Computer Guy helped them purchase an electronic health system that complied with the new standards. HITech introduced several new rules and added a subpart on breach notification. In July 2009, the security rule was removed from CMS jurisdiction. The security rule was transferred to the Office of Civil Rights. OCR then took responsibility for regulating all of the new HITech provisions. In August 2009, OCR published interim HITech rules. The final rules were published in January 2013. Almost every section of 160 and 164 was amended to incorporate business associates. High-Tech placed business associates directly under OCR control. Hudson and Priscilla asked Computer Guy to sign a new business associate contract that complied with the new standards. HHS proposed changes to the accounting rule, but these were soundly criticized. Public comments were referred to the Tiger team. HIPAA compliance is always changing. The Tiger team has recommended new audit control specifications. The goal is to make it easier to investigate inappropriate access of PHI by workforce members. Thanks for joining me in this tutorial. Now I want you to meet my colleagues, Roman Diaz, President of Touchtone Compliance, and Karen Darnall of Darnall Law Office.
We made these tutorials to help you learn about HIPAA and California law. For individual attention, go to our contact page. You can send us a message or schedule a consultation.
And I'm Roman Diaz, President of Touchtone Compliance. Our online tools and expert services provide everything you need to successfully address HIPAA compliance. We identify vulnerabilities, provide a thorough risk analysis, and assist with mitigation plans, policies and procedures, and staff training.